to the June 9th meeting of the Long-Term Care Planning Committee. We have an extremely full agenda. I hope you all had a chance to take a look at it. This is going to be an exciting meeting. We're going to talk about some changes coming up to our committee that I'm looking forward to, and lots of good report outs coming on some work that's been done between our March and June meeting. So with that, I'm going to kick it off to begin with our formal roll call. I do want to remind folks that the meeting is being recorded to be posted on our website, and CTN is also covering today's meeting. So if you do wish to speak, I remind you to please introduce yourself by stating your name and to stay muted to ensure a clean broadcast and clear recording. Good morning, Senator Lesser. Thank you for joining. So with that, I'm going to call the roll, and then we will dive into opening remarks. Christine Weston.
Hi, good morning. I'm here.
Morning. William Seals.
Good morning. I'm here.
Margie Gerendo Mercat.
Morning, here.
Margie. Okay, and I know Krista Oshashevsky could not be here today, so we have Yvonne Pantoja in her place. Yvonne?
I'm here.
Thank you. Erin Levitt-Smith.
I am here.
Morning, and I do want to point out to everybody, it's Erin's last official meeting with us. She is officially retiring this time for real. So welcome,
I
Erin.
will still be around, but not to this committee.
Yes. Barbara Cass.
Good morning, present.
Right. I don't think we're going to have Jessica Rival. Matthew Tazinski. Michael Santoro.
Present.
Morning, Michael. Laura Watson.
Present.
Good morning again, Laura.
Good morning.
Okay. Senator Hockadell. Huang's not here. Representative Valinsky.
I am here.
Morning,
Good morning.
Representative. Senator Anwar. Representative McCarthy Vahey. Senator Summers. Representative Claridis Detria. Senator Lesser.
Yes, I'm here.
Good morning.
Morning.
Representative Gilchrist. Senator Perillo. Representative Case. Representative Garibay.
Present.
Okay. Oh, could everybody please mute just so that we're having some background noise and we're being recorded and covered on CTN. So I just want to make sure that we minimize the background. So thank you so much, everybody. And with that, I would like to open it up to see if any of our legislative colleagues, Representative Garibay, Belinsky, Senator Lesser, would you like to offer any words of welcome before we jump into the agenda?
I'd just like to say thank you, Melissa, that I'm just very excited to be here with so many of you talented people, because we know that all of us together, we can make that change, but it takes all of us. So thank you, and I'm honored to be included.
Thank you.
And likewise, it's a pleasure to be with you this morning. We are looking to this group and to the advisory committee to really help the legislature in the state identify some paths forward as we wrestle with HR 1 and some other major issues involving long-term care. I know this is a important group, and You've been doing great work, and I'm just grateful to be part of the conversation.
This is Rep. Belinsky, and I would echo what we just heard from what I'm excited to anticipate as being our new legislative leadership team. But there's no doubt to anybody who knows Jane Garibay, Representative Garibay, and I, how valuable the LTC is to we in the Aging Committee. We have made so much progress, and you guys with Melissa's unbelievable organization and drive have taken us to the point where we're just big enough to, to grow into something even more formidable after today's meeting. So I'm just very excited. Thank you very much, everybody.
Thank you all. And I do just want to say a couple words before we dive in about our membership. We will be today going over some statutory changes that were made to the leadership structure of our committee. So we'll be talking about that. There was a little foreshadowing here for you. Also, I do want to very quickly at the top of this, we've already acknowledged that Erin Levitt-Smith is officially transitioning off, and Katie Daly will be starting at our next meeting, will be the DEMIS representative. And so we look forward to having Katie join us. And Erin, again, cannot thank you enough for your incredible partnership over these years and all the work you've done to support the committee and its reporting. And also, as many of you may know, the Office of Health Strategy, although it is being sunsetted as an agency, its work continues, but it's going to be continuing with staff moving into different state agencies. And so Jessica Rival, who was a member of OHS, they were a statutory member of this committee. She is no longer participating on this group, and because now we have representatives from the other state agencies already represented. So that is where we are with that. And so I'm going to move into our first order of business, which is going to be adoption of the minutes from the March 10th, 2026 meeting. You all should have received the minutes well in advance, so hoping you had a chance to look at them. Would someone like to make a motion to adopt the minutes?
So moved.
Thank you, Erin. Do I have a second?
Second.
Thank you, Michael Santoro. Any discussion, revisions? Okay,
I'd like to.
here it. Oh,
I'd like to
Oh, yeah, well-
abstain if I could.
yes, thank you. I'm sorry, Laura, did you have a revision? Or
Oh, yeah, I was present and I'm just not as on there as like other members present. So
oh, well, we will add you. Thank you.
not that it really matters. It's really not
Of
that big
course
of a
it
deal.
matters.
But
Nope, it matters. We will add you. Thank you so much.
thanks.
Okay. I'm going to take a vote now. All in favor of adopting the minutes as amended to add Laura Watson as being present? All in favor say aye.
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 Any abstentions? We have Senator Lesser. Anybody else? Objections? With that, the March meeting minutes pass. Thank you. So we'll now move on to updates and announcements, and I'm going to kick us off here. We are going to start off by, as you all know, our June meeting tends to be the meeting where we do our comprehensive legislative wrap-up of key legislation that passed during the previous session related to long-term services and supports needs. I'm going to kick us off with a presentation of Public Act 2672 because that one actually affects this committee and our sister committee, the Long-Term Care Advisory Council, directly. So if you give me 1 second, I will share my slides. Whoop. Okay. Share. There we go. Okay. Can everybody see the slide now? Okay. So sections 5 through 7 of the various revisions bill did make some changes to both the reporting and the structure of the long-term care planning committee. So it does a few things. The first is that it revises the areas that the long-term care planning committee, this body, is required to study. As you are all aware, Section B of Connecticut General Statute 17B-334 lists a whole bunch of areas that the committee is responsible for studying, or that the legislature has defined as being within our purview of study. And that includes things like Medicare, the number of consumers served in the community versus institutions, the dollar amount of Medicaid funding that goes towards supporting people in the community versus institutions. We're also supposed to be, we can study anything related to psychiatric services for individuals using long-term services and supports, items that support the Olmstead Act, and various other things. So this session, we have been provided additional areas of study that this group should be looking at, including state models for financing of long-term care, including but not limited to payroll deductions for long-term care. So if that sounds familiar, that's because that's very similar to if you think about the Washington Cares model, which is a payroll deduction that supports a nominal long-term care insurance benefit for Washington residents. So that's like an example of what that could entail. Best practices for workforce retention, wages, and standards. That fits beautifully with this group, as workforce has long been an area that this group has studied and looked at. Projected federal support for long-term care and solutions for insufficient federal funding. So we know that the long-term care climate on the federal level has been changing rapidly. So this group is now charged with looking at what we see as being potential, projecting future support, and what are some solutions we could implement if there are changes to our federal funding. It also deletes some things from the requirements. So it deletes the requirement that we include, when doing any studies, the number of consumers served. So when we evaluate the Medicaid expenditure data, which we're still required to study, we often put that in context by saying, hey, this percentage of Medicaid dollars was spent on the community, this percentage was spent in institutions, and then we also have been required in the past to report on, and here's the number of clients served in the community versus the number in an institution, to give those dollars context. We are no longer required by statute to report on the client component. So we still have to report on the expenditures, but the requirement to report on the number of consumers served has been removed. Doesn't mean we can't. We're not prohibited from doing so. It's just no longer required. And then it adds a requirement. Maybe it's not in this section. We will go on to the next section where we do have a new area of study. So that is a change to our subsection B of our statute. So then it also revises the long-term care planning committee leadership structure. So typically there has been one chairperson for this committee. That's how it's been since 1999 when it started. And that chairperson was voted into that seat by the members of the committee. So now this statute creates a tri-chair structure, and it specifically names the Office of Policy Management Secretary or Secretary's designee to be one of the chairs. So for now, that is me. I have been appointed to serve in that role. And then it adds 2 additional chairs. As you all know, our long-term care planning committee is comprised of about 9 HHS line agencies who all have a different role in long-term services and supports. And it's also comprised of the chairs and ranking members of the Aging, Human Services, and Public Health committees. So what this statute does is it says that in addition to OPM, there must be a House chair and a Senate chair that are elected by membership of the Long-Term Care Planning Committee to serve as tri-chair. So from among the members, the legislative members of this committee, we have to elect a House member and a Senate member to serve as chair. And we will be voting on that shortly in our agenda. All of you should have received that Representative Garibay and Senator Lesser are the legislative nominees to serve in that capacity. And I very much look forward to the official vote and getting to work with them as we move the committee forward. So it also revises the annual long-term care planning committee rebalancing report. So if you remember, every year, January 1st, we send a 4-page report to the legislature. The first page shows all the history of the number of consumers that we have served in the community versus in an institution. And it shows the history of that all the way back from when we started the state's rebalancing efforts in 2007, all the way to present day, so we can track trends. The second page is expenditures, and the third and fourth page show how much funding goes towards nursing homes specifically, not institutions, but just nursing facilities, and how much of that is paid for with Medicaid dollars versus other sources of funding. And then we do a net state spend. So how much does the state of Connecticut actually spend on skilled nursing facility care versus home and community-based services? So what this statute changes is it eliminates pages 1, 3, and 4 of that report, essentially. Those are no longer required. Again, doesn't mean we won't do them. It just means they aren't required. It maintains the expenditure, the Medicaid expenditure part of the report. And then it also adds that all those areas of study in section B, it's an entire paragraph of areas of study, we are now asked to, within available appropriations, incorporate our study and findings and recommendations on those areas of study into the annual report. So that is going to be an enormous lift that the group is really going to want to plan for and think about how we do that. And then it deletes, we already talked about it deleting the number of individuals. And as I said, we probably will still want to include that because it provides vital context. It's just not required. And then it adds the requirement that our annual report include a listing of long-term services and supports available in the community and in institutions. And because that can be very amorphous, I think one of the things this group is going to want to do is really define what does that mean, because it's not really feasible to list every single long-term services and support available in the community and institutions. But we have My Place CT, we have 211 who do have those listings, and then we can try and get some clarity so that we can scope that out to something that this committee can report on annually. Are there any questions on that at this point before I wrap up and move on to the end? Okay. It also adds a one-time report due January 1st of 2028 that alludes back to, I think, what Senator Lesser mentioned in his opening remarks, that we do have some federal changes coming, have come with HR 1 and some other regulatory changes that affect the financing of long-term care options in the state. So we are being charged with studying that and soliciting feedback and recommendations and issuing a report on the impact of those changes to the state and our recommendations for further action, and submitting that to the legislature by January 1st. Now, the good news about this date is that it coincides also with when our next 3-year long-term care plan is due. So we're doing a lot of this type of research and planning to prep for the long-term care plan, so we can be traveling those two paths simultaneously. And again, all of this is within available appropriations. So that is it to changes to the Long-Term Care Planning Committee. I am going to briefly touch on changes to the Advisory Council. Michael Werner who is current chair of the Advisory Council, he's having his meeting on Thursday, and all of you are invited to come, and I'm sure he'll talk more in depth about these changes at that meeting. But before I dive in, any questions related to the changes to the planning committee itself? Okay. So our sister council, the Long-Term Care Advisory Council, which although we're the state arm, we then have the arm of the long-term care planning work that is comprised of advocates, providers, individuals who utilize long-term services and supports, the unions that represent the nursing facility and home care workers, as well as the nursing home and home care industries themselves. So that group has some new members added to it. Representatives from a state legal services entity have been added. And for the first time in the group's history, a state employee has been added to that group, and that would be me. So the OPM, for now it's me. The OPM secretary or secretary's designee has been added to that group as well. And then it also adds the House and Senate chairpersons and ranking members of the Human Services Committees or their designees as members of the committee. And there are already other legislative members and other legislative appointees on the committee. So this is just making sure that in addition to those members, that the House, Senate, and chairpersons, ranking members are also on the committee. Then this particular statute was silent on how leadership is selected for the advisory council. So the statute clarifies that the House and Senate chairpersons shall jointly appoint the chair of the council. And it says chairpersons of the council. So I'm not sure if the intent is, it leaves it open for there to be one or more chairpersons. And it clarifies that the advisory council's role is to inform the long-term care plan developed by the Long-Term Care Planning Committee. So although that's historically always been their role, this really clears it up. It just outright says that's what the role of that group is. Whoops, excuse me. And it also permits the acceptance of gifts and charitable donations to help finance its work. And then I just put, and this is all going to be on our website. We just went through a website migration, and I realized that some of the links are not working from today's meeting. It's all on the public meeting calendar, but I will go through and I will fix the links on our long-term care committee webpage. But here's just for more information, our current long-term care plan, our current annual report. And if you wanted to see what our areas of study, so you can comprehensively see in addition to the long-term care financing ads, this is everything that we are charged with studying now. And this is what our annual report looked like prior to the revisions. And that is the end of my presentation, and I'll open it up to any comments or questions, or if anyone would like to make comment. Okay, seeing none from membership, would any of our legislative members like to make comment? Senator Lesser.
Yes, thank you. And first of all, I thought that was a very good overview of the legislative changes. I am, I know that the committee no longer has to collect that consumer data, that requirement has been removed. Just as a member of the committee, I still think that might be useful data. So if it's not a heavy lift and we're already doing the work, I also suspect a lot of it is already being reported to the feds, that we consider continuing doing that if our resources and, ability is sufficient. So that's my own personal view. And, I don't know if that's legislative intent or not, but that's certainly something I think we should try to do if we can.
Yes, absolutely. I agree. I think it provides important context, and it is something we report to CMS. So we will can certainly continue to collect and report on that data. Anybody else? Okay. If there are no other comments, then I am going to move into our voting. As I said, I am very pleased that Senator Lesser and Representative Garibay have been nominated to serve as the legislative portion of the tri-chair structure of this committee. And at this time, I am seeking a motion to formally nominate and vote on Senator Matthew Lesser and Representative Jane Garibay to serve as the legislative chairs of the Long-Term Care Planning Committee. And I see a motion made by Representative Belinsky. Thank you.
Absolutely so moved, Madam Chair.
Thank you. Do I have a second?
I'll second. This is Christine Weston.
Thank you, Christine. Is there any discussion? Seeing none, I will take a voice vote. All in favor, please say aye.
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 Are there any objections? Abstentions? Seeing none, motion passes. Congratulations, Senator Lesser and Representative Garibay. Very happy to have you as chairs of this committee. Look forward to doing good work together. So I think we have, it's really an exciting time ahead. This group has really recently reinvigorated itself and been, as you will hear later in our meeting, been doing a lot of good work to prep and plan for the next long-term care plan and to monitor progress of the current plan. And I am really excited to see where we go from here. And so with that, I am going to jump into, I'm sorry, Senator Lesser and Representative Garibay, would you like to make any comments in your new chairdom before I hop into the next part of the agenda?
Thank you so much. I'm honored to have the support of the members. It was not the most grueling political campaign I've gone through, so but very grateful, and thank you, Representative Belinsky, for your kind words. So looking forward to doing the work, and we will get to work.
Great. Okay. I don't know. Did Representative Garibay, is she there? Did I lose her? I think we lost her for a minute. So with that, I'm going to move on now to the our annual legislative update. And I am going to kick it over to my colleague here at the Office of Policy and Management, lead planning analyst Heather Ferguson Hull, who has helped to put together our legislative update for the last, I don't know, I think about 4 years now, and she always does a wonderful job. So with that, Heather, I'm going to kick it over to you.
Thanks so much, Melissa, and good morning. Good to see you all today, and happy to share this update. As Melissa said, I've been doing this for the past few years, and also very aware of the folks that I'm presenting this to. A lot of the people are the people who help make these new laws. So keeping in mind that I'm happy to have those additional comments afterwards, things that you might want to add after my presentation. So I'm going to start by sharing my screen. I've got just a little slide deck. So hopefully you can see that. All right. So yeah, so this is our legislative update. There's a full report that has been prepared. There's about 21 bills on that report with at least one section. Some have many sections that pertain to LTSS. And so that will be going out after this meeting. For this particular meeting, I'm going to be focusing on 3 themes. Because obviously there's going to be other bills that Melissa's already covered, that Maria's going to cover, legislators may wish to cover. So just wanted to highlight under 3 broad themes some of the bills that passed this year. So it's quality of care, access to care, and HCBS and community inclusion. So the first section is quality of care. So we have Public Act 2612, which was House Bill 5003 out of the Labor Committee, Workforce Development and Working Conditions. This was a large omnibus bill, but there's a couple sections I'm going to talk about, but related to quality of care is section 17, which is about the PCA fiscal intermediary reports, which this will just require DSS to file quarterly reports about the FI, which is GTI, as most of you know. And GTI provides services to consumer employers, people who self-direct their services under state programs, state home care programs. So the reports are going to include information as long as it's not exempt from disclosure under FOIA, will include information on PCA timesheets and certain contract compliance issues. And that is effective as of July 1 this year. The next bill I'm going to talk about is PA 2639, which is the Act concerning DDS's abuse and neglect investigations. So this has a number of components, but the first one is that it's going to give upon request copies of the original or evaluation reports of alleged abuse or neglect to a parent or guardian or other legal representative of a person who's receiving DDS services, provided that person is not the alleged perpetrator or somebody who lives with the alleged perpetrator. It'll provide the latest version of the department's guide for individuals and legal representatives when an allegation of abuse or neglect has been made at each individual annual planning meeting. And it's also going to ensure that all DDS staff are trained in the requirements for confidentiality and sharing of information regarding abuse and neglect complaints. There's a lot in this bill. It's a good bill. Expanding the required content of the annual report of abuse and neglect reports and investigations, expanding the scope of the 5-year review of policies and procedures to include a review of the method for sharing the original reports and evaluation reports of abuse and neglect, and 2, the method for sharing individual reports and evaluation reports, and 3, the systems used to screen persons, which is something wanting to make sure that good screening there already is, but we're just going to continue to have that as part of the evaluation every 5 years to make sure that those screening processes for folks who are providing services are as rigorous as possible. And the last part of the abuse and neglect report portion of this bill is to ensure that all the materials related to the prevention of abuse and neglect are disseminated through a consumer-friendly and easily accessible website that ensures the widest possible access to services for families and individual disabilities. And also, as legislators know, there's going to be an annual hearing that will review DDS's annual report through committees of cognizance, human services, and public health, and just to ensure that DDS and DSS are ensure compliance with federal Medicaid requirements regarding safety and quality of care. And that is all effective July 1 as well, except for the investigation report provision was effective upon passage. That's a lot in that bill there. The next one I'm going to cover under quality of care is the act requiring training for homemaker companion agency employees. So this requires homemaker companion agencies to provide at least 8 hours of training annually to both new and current employees, and certain topics that have to be covered, such as identifying abuse, best practices in personal hygiene, etc. And DCP will approve those topics. DCP is going to post those topics on their website, and each agency, homemaker companion agency, is going to ensure that each employee completes each of those topics at least once every 2 years. The bill also requires homemaker companion agency and employees to attest to the DCP that the training's been completed, and it also allows agencies to advertise that their employees have complied with this training, and they can also talk about the training topics that they cover. And additionally, the bill requires that each homemaker companion agency registry ensures that any individual it supplies, refers to, or places with a consumer complies with the training requirements. And this one was effective upon passage, except for the provision allowing agencies to advertise during the training requirement compliance is effective January 1, 2027. So those three are the bills that I'm highlighting from the report around quality of care. And before I move on to the next slide, any questions or comments? Okay, the next theme is around access to care, always equally important. Quality and access are two of our perennial things that we like to highlight, and seeing great progress on both those fronts. So the first one is from the TCB committee, the Transforming Children's Behavioral Health. And Section 3 is of particular concern to this committee because this is studying the feasibility of establishing an inpatient facility to provide psychiatric treatment services to children and young adults ages 14 through 21 who have intellectual or developmental disabilities. The second one I'm going to highlight is PA 26151, which was House Bill 5557, and this is looking at the definition of intellectual disability and establishing a working group around American Sign Language education and NEMT reimbursement. So a lot in the bill. The first section is looking at eligibility, looking at the intellectual disability definition, and that the DDS commissioner needs to come up with a plan for the definition of intellectual disability. So the plan has to include a recommended timeline to transition to the new IDD definition, two, any required federal approvals obviously have to be in compliance with federal law, and three, estimating the one-time cost of transition and recurring costs of using a new definition for DDS and the impact on other state agencies and school districts that would be impacted by the change. Briefly on the ASL program, obviously this has been an ongoing issue too, making sure that there's ASL interpretation program. So this would provide recommendations to SDE around curriculum guidance, expanding the interpretation programs, and ASL teacher certification standards. And they also have a report due July 1, 2028 to committees of cognizance, which in this case are the Education and Human Services committees. And then lastly, as I said, the NEMT component studying requiring DSS to study NEMT reimbursements, rates, and service availability. And that report is due to the committees of cognizance on February 1, 2027. So any questions about the access to care bills? All right, and then the last section I'm going to touch on is HCBS and community inclusion. So first one is back to the labor bill I talked about earlier. This is a different section of 5003, also now Public Act 26-12 concerning workforce development. And Section 5 is the subminimum wage task force. So this is, as you all are probably aware, 14C certificates allow for people to be paid subminimum wages. And so this task force is going to look at it to study additional services, funding, and benefits that may support people with disabilities who do earn less than a subminimum wage. So the task force is required to examine the potential benefits and existing impediments to the state's use of those additional services, and two, make recommendations on funding sources and benefits that the state can provide. And so the bill will require the task force to report back to the Labor and Human Services Committees by January 1st, 2028. Additionally, we have Public Act 2668, which I'm not going to read the whole title of it because it's a very long title, but it's basically the budget bill. It was also known as Senate Bill 1. Lots of sections in there, but just two that I'm going to highlight that are pertain to LTSS is Section 271, which is a tax credit for family caregiver expenditures that will create a non-refundable income tax credit of up to $2,000 for income eligible family caregivers who have eligible expenditures to care for and support an eligible family member to help keep folks in the community. And that is effective January 1, 2027, and it will be applicable to the tax years starting on or after that date because it is a tax credit. And then the other one I want to highlight from the budget bill is Section 343, which is an Aging in Place grant program, which establishes an ADS grant program to be created in consultation with DOH to aid certain homeowners with making accessibility modifications. So they, once again, helping people remain in their home. And there's just criteria around that they have to be at least 60 years old or have a disability and income no greater than 60% of AMI. And grants are capped at $10,000 per eligible homeowner. And last but not least, this is another lovely long title, the rate review, dental representation on MAPOC, biomarker testing, opioid prescription coverage, and the study requiring payment of spouses for state subsidized home care. What I'm going to highlight is the last portion of that bill title, which is Section 5, the working group on compensating spouses providing personal care assistance. It's going to be a 6-member working group to study the feasibility of allowing spouses to be compensated for providing personal care assistance for spouses enrolled in Medicaid home care programs. The membership will include the DSS commissioner, the OPM secretary, and the Human Services Committee chairs or their designees, and then also will include a consumer of PCA services and a representative of an organization providing these services. And those folks, those other representatives, will be appointed by the Human Services chairs. And the Human Services chairs will also appoint the chair of the working group. And this report is due to the Human Services Committee on January 1st, 2027. And with that, those are the 10 or so bills I just wanted to highlight. Lots of other interesting bills that I'll be sending out in the report after the meeting, but just thought those might be of particular interest to this group. So any questions, comments, additions? Well, thank you, Representative Belinsky. I appreciate that. Thanks, Christine. All right, with that, I will pass it back to you, Melissa. Actually, no, I can pass it straight to Mairead, can I?
You sure can.
All right, Mairead, over to you.
Hello, good morning. First of all, I also want to thank all of the legislators, our state agency partners for the work this session. We did again get a lot of things across the finish line that will help improve the quality of life and quality of care for individuals in our state receiving long-term services and supports. And again, we are one of the first states in the country to pass some of these bills, so very exciting. The first bill I want to talk about is Public Act 2613, and this has concerns related to various revisions of the public health statutes. One of them is the managed residential communities or assisted living communities, as a lot of us would refer to them as, and whether or not DPH should license these communities. So that's a discussion that's going to be coming up. There will be a working group, and I think it'll prove that it'll also support a lot of the questions that have been out there related to these communities. So I'm looking forward to that. It also covers nurse aides and DPH oversight and who it is expanded to under the nurse aides in the registry. Public Act 2628 is an act concerning the use of virtual monitoring technology in residential care homes. This is a bill that we passed several years ago for nursing homes and in managed residential communities. However, we did not include residential care homes at that time. So we really wanted to get them included in this as well, as we've seen that it has worked well in those other settings. So we were able to expand the coverage to residential care homes as well. And then Public Act 2644 is an act requiring the fear of retaliation training for persons providing care in those managed residential assisted living communities. And this, again, is something that we had passed previously in nursing homes several years ago. We've done an updated video and training related to the fear of retaliation. And we're really hopeful that when people know better, they'll do better. That's what we've seen in the nursing homes where it's currently offered, and that there are so many individuals choosing to receive their long-term services and supports in these other settings. We wanted to ensure that they also had the information and education to help family members and residents talk about things that concern them in a way that doesn't create further anxiety and upset. Public Act 2672 is an act concerning various revisions to the Human Services statutes. I want to thank Senator Lesser in a very forward-thinking way. We saw some things that could have potentially been changing at the federal level related to individuals and antipsychotic pharmaceuticals in nursing homes. And so we were able to, in Section 10 of this bill, we were able to look at what the federal requirements were and incorporate them into Connecticut law. So if there are any changes at the federal level, residents here in Connecticut will still have those protections. So thank you, that was very important. Also in Section 1 is the posting at managed residential communities that requires them to have postings regarding suspected abuse, neglect, exploitation, and abandonment of an older adult, and their needs for protective services, and the contact information for DSS. Again, just ways to ensure that individuals know how to get the help and resources that they need. And then Public Act 2674 is an act concerning public hearings for certain rate increases at assisted living facilities. And this is a concern because we've seen this happening, increasing rates of increases, financial increases for rent in these settings, and that's been a concern for many individuals. When they move in there, they plan on how long they'll be able to stay there, how long their funds will last them. And with the types of increases in the rates that we've seen, it's really impacting the individual's ability to stay there. So making that more public, hoping that people are aware of which facilities bloom their rates more frequently. We'll hope that people moving in there will have that awareness and be able to plan. There's also an emergency power and generator requirements in this bill related to the greater community, and personal protective equipment for home health aides. All right, and then the nursing home bed moratorium and nursing home resident data. I think this is important because we want to make sure that there's access to the appropriate number of beds in each area of the state, which is what Right Size for Balancing was originally working on. And now we want to just ensure that if there are additions to beds in the area, to those settings, that it meets the needs of the people living in those areas of the state. We certainly don't want to leave anyone short, but we don't want to be overbedded either. And then Public Act 26103 is an act requiring nursing homes to annually report certain ownership information regarding investment entities. The title is much longer, but this was a really important bill that got passed. This is one of the ones where I think we go the deepest and the furthest of any state. And this will just allow for those further protections and oversight in those long-term care communities to ensure that the owners and the people managing nursing homes and these settings are putting their best foot forward. We know who's providing care and services in our state, and that there's an opportunity to ensure the stability of those buildings through funding support, and that it doesn't fall on the state or the citizens in our state through taxes, that it really is the accountability of the owners of those buildings to protect the residents there too and have that stability. And then finally, Public Act 2635, which is the HEROES Act. And in that is a report that I need to do related to having a long-term care veteran ombudsman. And so we will be working to get all of that information and provide that report to the legislature by the end of the year. I did not have fancy slides like Heather and Melissa, but thank you all. Those are all the bills that I have.
You did a
Aaron?
great
Wow.
job.
You know what,
oh.
Rep. Walensky, I apologize, Melissa, for wowing in there. This commission is so amazing because as committee leaders, we often don't know the part that we play in creating such incredible move forward policy in the aggregate. And listening to what Mairead just reviewed was heart stopping. Everybody on this commission and all of the component committees that are doing this work hand in hand with you is hard to get your arms around, but it's breathtaking. So thank you so much. This is I'm blown away. I had no idea that we were accomplishing so much. It's incredible. And by the way, I see Michael's picture there. Michael Werner, you are an inspiration to, I think, all of us. So thank you very much for your advocacy. You are always there on our heels, and we love that.
Well,
Thanks,
thank you,
guys.
Blinsky. You guys give us a lot to keep us busy the rest of the year, which is good. We can't say that we're bored or don't have anything to do, but it's all good stuff. Erin?
Thanks. I wanted to ask about the antipsychotics in the nursing home. So was that legislation based on the black box warning from the federal government? So you use those guidelines? Because as you know, our clients in Demas need to be on antipsychotics in many instances when they go to a nursing home. And I know we, especially at 60 West, we're using guidelines from the black box warning from the feds. So I was just wondering, could you be a little more specific, and did you use that federal guideline for this?
Yes, it's exactly the same federal guideline, just that there was some discussion in February about rolling back some of the federal requirements and guidelines. And in order to not see that rollback impact the individuals being served here in Connecticut, it is the exact language from the federal guideline. So there should be no experience.
Yeah.
No one should experience any change. We are just reaffirming that those are the requirements we believe in and that they should stand.
And regardless. Great. Thank you.
Correct. Yep. Any other questions? Great. Well, thanks for inviting me today. I will see you all later.
Thanks, Marie. Thank you, Heather. Thank you, Maureen, for your excellent presentations. And the presentations you just sat through didn't even get through half of the long-term services and supports bills that passed this session. So a lot of work ahead, a lot of good protections passed for the people who need the services of the state of Connecticut. So look forward to getting into that good work. And at this time, let's see if there are no other questions. Oh, I did want to just say, and I'm going to put it in the chat right now, is that every presentation that you saw today, as well as the comprehensive summary, in case you didn't memorize everything Heather and Marie just said, a full comprehensive summary of the bills they reviewed, as well as all the other bills that we didn't get to verbally touch upon today, because as Heather said, there's over 20 of them, are in our annual written long-term services and support legislative update. And so that all those materials will be posted on the Long-Term Care Planning Committee website within the next 24 hours. So you can go to the link I just put in the chat, our Planning Committee website. The link to this meeting will be there, so you can rewatch any parts that you may wish to hear the dialogue and explanations, as well as the written materials. So with that, I would like to open it up to see if any of our state agencies or legislative members have any comments or pieces of legislation from this session related to long-term services and supports that they would like to highlight for the group. Erin, is your hand up as a legacy, or is it? Okay. All right. Margie?
Thanks, Melissa and Heather and Marie for those awesome updates and incredible work. And just wanted to offer a very small addition. I wanted to mention Public Act 2674 included some changes to the municipal agent language. And I think we all know the important work that the municipal agents do in the communities to support older adults. So the language changes under this act included requirements for municipal agents to be free from conflicts of interest. It allows municipalities to share a municipal agent where it helps in some of the smaller towns, and it renames the municipal agents to municipal agents for aging. So just some small additions to the really important work that the MAs do, and thanks for that opportunity.
Sorry. Thank you, Margie. That was a great flag. Does anybody else have anything they would like to share? Christine.
Hi, good morning, everyone. This is Christine Weston, Director of Community Options at DSS. It's not this current legislation, but I do want to share an update from last year's legislation, because as we know, this happens every year. So we get lots and lots of great ideas that come through every year, and sometimes we get the new shiny object and forget about last year's, right? So I just wanted to share last year legislation went through on the Katie Beckett waiver, which those of you know, Katie Beckett waiver allows access to Medicaid for children under 18 to not consider their parents' income for eligibility and get access to Medicaid state plan services and access to community first choice and in-home supports. And it's a tremendous service. And there was incredible legislation passed through a working group last year, and we have made tremendous strides in that area. Sadly, there was an editorial published today saying we're not doing enough, but we actually want to get out there all that we are doing, because I don't think the community realizes the tremendous gains that have made in the last 12 months. So maybe in a future meeting, Melissa, we could provide that either as just a slide update or just kind of a report out, because the kiddos, you know, again, LTSS is a continuum, right? Not just older adults, just not individuals living in nursing facilities, but also our children and our youth that are going to need long-term services and supports throughout their lifespan. I'd be happy to give that update. We've really moved the needle, and it was due to very strong working groups and legislators, some of which that are on this call, really pushing for change. So we're very excited about that and would like an opportunity to formally share updates.
Great. Thank you, Christine. And I'm certain that Senator Lesser, Representative Garibay, and I can talk when we're having discussions about the next agenda, can keep that in mind, and because I think an update would be welcome. Barbara Cass.
Thank you, Melissa. I just wanted to share two updates, one from this past session, which impacts a smaller population than the large LTSS community, but we did have legislation successfully passed to modernize our medical orders for life-sustaining treatment program, which will provide greater access to individuals who are interested in doing advanced care planning and do meet the eligibility requirement for a MULST. We have revised our regulations. We have included physician assistants in the ability to make that determination that an individual is eligible for a MOLST. And we have also made the form digital. Currently, it's a lime green antiquated form, paper form that has been identified as a barrier. So we're happy to say that passed this past session, and we anticipate that it'll provide greater access to individuals who do select that level of advanced care planning. And secondly, we continue to work on the design of a Center of Excellence program for nursing homes. So DPH 2 years ago was charged with designing a model, and we are in the final stages of that. So more to come on that. Thank you, Melissa.
Thanks, Barbara. Appreciate you flagging that, and you have certainly done great work on Molston, advertising the need to modernize that, and look forward to doing more work around the centers of excellence as well. So that's fantastic. So thank you for that. Anybody else have any other updates before we go to our next item on the agenda? Okay, seeing none, thanks to everybody. This was a busy and productive legislative session. So now we get into the work of implementing it all. So thank you. Our next item on the agenda is going to be our work group updates. For those of you who are joining the committee for the first time, the Long-Term Care Planning Committee's main charge is to develop a 3-year long-term services and supports plan that addresses some statutorily required content areas and really addresses improving the system of long-term services and supports for Connecticut residents, regardless of age or ability. So it really spans from birth to death and includes entire sections on data, trends, and projections to determine what Connecticut's changing population looks like in terms of demographics, from the number of individuals age 65 and older, the number 80 plus, and the number of individuals residing in our community with some level of disability, and projecting future need for long-term services and supports, as well as the funding streams for those services, and how Connecticut could begin to shift from a reliance on the Medicaid system to cover the cost of the provision of those long-term services and supports, to looking more at private-public partnerships, other sources of non-Medicaid funding. So as we are currently implementing our 2025 plan. So that ends December 31st of 2027. And we have to submit to the legislature our next 3-year plan with goals and recommendations and updated data on January 1st, 2028. And to really take a deep dive and overhaul that plan and make sure it's still meeting the needs of Connecticut residents and those who serve them. This group formed 2 work groups. One is the Long-Term Care Plan Implementation and Progress Tracking Work Group, which is made up of members from this Long-Term Care Planning Committee, members from the Long-Term Care Advisory Council, as well as individuals who utilize long-term services and supports or have loved ones who utilize long-term services and supports. And they are tracking the progress that we are making towards implementing the recommendations and meeting the goals that are in the current 2025 long-term care plan. Then we have a second committee that is the 2028 long-term care plan development committee, or I'm sorry, work group. And that work group has a similar composition of planning committee, advisory council members, and individuals utilizing long-term services and supports. And they're undergoing a process to help to develop the goals and recommendations that should be included in the next 3-year long-term care plan to move the state forward towards unified vision for our long-term services and support system. And with that, I would like to introduce the chair of the Long-Term Services and Supports Plan Implementation and Progress Tracking Work Group, Karen DeNorfio, who is going to provide us on a work group update of what that group's been up to since we last met in March. Karen.
Good morning. Thank you. I'm Karen DeNorfio, and for those of you who I'm not familiar with, I have a background in skilled nursing, primarily in nursing facilities, but most recently and currently working at Harvest Healthcare and Behavioral Health to sort of expand my horizons into all the areas of long-term care. I'm very happy to lead this work group, and I really, really appreciated all the encouraging and motivating words throughout this meeting, and particularly at the top of this meeting about collaboration. And I really hope to be an impactful part of that. So I'm really happy to be here. As my report out, since the legislative session came to a close, our committee work group has reviewed and familiarized ourselves with PA 2672, as you are all now newly familiar with. We've very cognizant of the new areas of study when determining our focus areas for progress tracking, which include the state models of long-term care financing models, workforce best practices, and projected federal support and solutions for federal funding to support long-term care services and supports. Please be aware that the annual document will be sent out very soon by Melissa on behalf of our work group for a compilation of a status report for the annual LTSS plan for Connecticut. And we will be reviewing that upon its completion. Our work group has also reviewed an Excel sheet, which is meant to help. As you know, it's many, many pages, and there are so many great areas to look at. So in order for us to determine which areas we can really hone in on and focus on, we've kind of been breaking them into some larger areas because they all kind of impact each other. So we have some theme areas listed, which we've developed as waiver wait lists, limitations to access, family caregivers, use of technology, hospice and palliative care, transportation, innovation, behavioral health, varied housing opportunities, and workforce limitations. So there's quite a few areas there, but a lot of the areas on the plan fall into one of those general topics. And then we're working also to kind of pull together some potential presenters that could help us with a short presentation at the beginning of each of our subsequent meetings as an invited guest to help us better understand an area of the plan or work that might already be done or work that might be needed to be done. And if that would be a focus area that we would like to look further into, or if we're sort of satisfied with where we're at with that particular area. We have some presentation ideas coming up on hospice and palliative care, the AARP scorecard, some technology updates, and several more. Really, the list just goes on and on. There's just so much for us to look at and review in order to pull into our areas of focus. So that work will continue, and our next meeting will be on July 10th. Thank you, everyone. Is there any questions that I can answer for you? Thank you.
Thanks, Karen. And I just want to stress, I don't think it can be understated the amount of work that went into. I briefly, while you were talking, Karen Scree shared the unbelievable grid you made of all of our recommendations and trying to categorize them. The work that this group has done to try and wrap their arms around the several 30 plus recommendations in the current plan and group them into categories to find focus areas that they can actually evaluate has been quite a job. And I am very grateful to Karen for her leadership in focusing that task. She did mention the annual update report that we do where state agencies get a document, a grid that they fill out. This year, it will be going to the evaluation, to the Implementation Evaluation Committee. And I just want to show you all this. This should send shivers down your spine. It's your annual plan that you get. And it's just a reminder that on the left are the recommendations that are in the plan. And then we ask each agency to fill in administrative and other actions that have been taken over the course of the fiscal year. So this will be for SFY 26, and it'll be due the end of August because 26 doesn't end till the end of June. Where we ask people to write up their programmatic, their little brief updates. And then we also fill in legislative actions that were taken in 26 that speak to some of our recommendations of the plan. So we will compile this It'll then be shared with the implementation and tracking work group, and they will be using it to inform their work to decide where maybe continued work needs to be done and they want to do a deep dive to further to do some additional evaluation and help move us toward our goals. So that is coming your way shortly after this meeting. And with that, I will turn it over to the Long-Term Services and Supports Plan Development Subcommittee for their update, and that will be given by co-chair Heidi Gill. Heidi?
I had to mute there. Thanks, Melissa. Great work, Karen. Excited to see that and begin to integrate what we're finding together. And thank you all. It is an honor to be working with this amazing group of people very passionate about the continued work to advance improvements in long-term care service and support. So we've had a really, I think some really good progress. And I think Representative Belinsky, you said it best, it's a lot to put your arms around ultimately, and our hearts and minds are in it. And let me just share my window here. If I think I can share it, Melissa. Actually, it's not coming up, Melissa. Let's see.
Okay, I can share it if it's not popping up. Let me pull it up. Hang on.
I have to give me the privileges to do it.
Yeah, you should have. Let me see. Okay, you should be able to share. And if not, I'll just pull it up so that.
Yeah, I think you need to. It's not letting me do it.
Okay, no problem. Let me just grab it. Okay. All right. Tell me. You should see it in a moment.
There we go. So again, such important work, and as a chief strategy officer at LiveWell, it's exciting to apply a process that is hopefully going to continue to be productive moving forward with this amazing group of people that have gathered together, along with the many other people we need to engage in the process as we get additional stakeholder feedback. But a strong process is needed to get our arms around this and ensure that we have a shared vision. So we started by really looking at the current plan and those priorities and saying, you know, what's really important from the perspective of this group that we need to continue to leverage and continue to work on with this next plan. And so there was a great survey that was collected by Melissa and her team to collect that information from our work group. And then we also had another survey, which really people compiled. It's based on the framework of SOAR, which we'll go into in terms of how that has advised our planning and our planning session. But ultimately, all this information and data were gathered before we even got together with step 2, which was to conduct our first strategic planning session. So next slide, please. So Melissa, I was hoping you could share for me, because one of the things that we did, the reason why we did this step was to really understand how do we get to shared vision and work, and sort of what are the priorities with all the great minds that are working so hard at this. So Melissa, will you share what these slides are about in graphics?
Sure. So, and many of you answered the survey, but we issued a survey to the full long-term care planning committee, advisory council, and work groups, asking them to rank each of the recommendations in the current long-term care plan as to, under each category, we have several overarching themes in the long-term care plan: financing, housing, infrastructure, programs and services, quality, and workforce. And under there are at least 10 different recommendations. And so we asked folks to go under, via a survey, to go under each of the categories and rank the top 2 recommendations that they feel must be included in the next long-term care plan. And if they had to choose to eliminate, because we've already as a collective group said we have way too many recommendations, some are duplicative. So we have decided that we're going to scale back the number of recommendations and do a few key recommendations very well. And so to do that, you have to make the tough choices of which recommendations would we cut in the next plan, or where are areas, not that we don't think they're not important, not that we don't think work doesn't need to be done, but just that for the purposes of the next 3-year plan, where do we need to focus our energy to move Connecticut forward? So this was a quick just temperature check, I call it, to see where long-term care planning committee and work group members were in terms of where their priorities were, what they wanted to keep, and what they wanted to cut. And as you can see from this color wheel that my colleague Nick Turcott helped make, because doing this was beyond my abilities. So you can see we are all over the place. We are a very stratified group. This color wheel represents what the survey results yielded as being top priorities. So the big outer wheels where you see the 24.9, the color, the purple, the orange, those are the categories. The larger, I'm sorry, I moved up one when I didn't mean to. These are the larger categories. So you can see that programs and services, and that's where we talk about correcting waivers and things like that. Not correcting waivers, I'm sorry, expanding waivers. That's all under that green section. And it shows us how stratified our areas are of priority. Then these little teeny breakups are the various recommendations under each category. And when you look at that, we are clear across the map as a group in terms of what we think the priorities should be. It's totally stratified, which is what will bring us to why the SOAR exercise that we conducted as part of the strategic planning process became so critical in our work to begin to hone down really what are the priorities that this group needs to be focusing on.
Thanks, Melissa. So yeah, just really it was wild for us all to see and digest together as a team. And it was a lot of fun just being together in person, because to create this shared vision with multiple perspectives, with respect and with courageous conversations, I think is really important for us to continue to think about how we get in person, because we had a really great and productive session together. That was just a half day, but very productive. So the goals of that planning session were clearly to have some clarity around shared priorities. And as you can see, it was scattered. And then how do we think about alignment through our strengths, through our opportunities, through our aspirations and results? And that is the SOAR process. And then how can we come together and really think about those next steps strategically? So next slide, please. Oh, sorry. So SOAR is really just to build off of the SWOT analysis that I'm sure many of you have gone through, and maybe even through a SOAR process. It's built in from a lens of positive psychology to really make certain you start any plan with first leveraging the assets and capacities and strengths of the situation. And so we brainstorm strengths, moving from those strengths to really identifying those important opportunities that really create a growth mindset. And then the aspirations, stating out loud the relevance and shared vision of the group to proceed forward. And then ultimately, what are those results? And Karen, I thank you so much for what you're doing to think about what are we going to do to tangibly look at progress, track progress, and celebrate achievement. So next slide, please. So our strengths obviously are what do we do exceptionally well, what makes us unique, and what are we consistently currently making a positive difference in. So we have pages of the SOAR results, and I'm just going over very high level results with you so you can kind of see some of what we really came to. But ultimately knowing that we have a strong community-based infrastructure and that we have achieved so much progress towards rebalancing was absolutely critical to say out loud in the room, and that there is a generous amount of funding and support through Medicaid and long-term care services and supports. that there's flexibility and diverse care models that have been implemented. There's strong collaboration, advocacy, stakeholder engagement, and legislative support that we receive along the way. The array of housing and family supports were reviewed, and what we can leverage to potentially expand upon. And then ultimately, we definitely have a ready-made structure to advance this work. So those were our strengths. Again, much more detail within that if you want the full report, right, Melissa?
Yes.
So opportunities. So based on those strengths, what do we need to build and expand on? What do we need to improve and refine? And what do we need to create and design that currently does not exist? So based on that discussion, obviously workforce came up as a key priority as we are asked to really focus in this area and study it further around the quality of workforce, the ability to create the strategies that can have career pathways and well-being supports. Also, the thought of really taking a pilot that's been in play for some time and has been working well, the assisted living models, and expand and replicating that pilot. Continuing to improve in the access, navigation of care coordination, always a very important thing to consider, and the details within that are quite vast. But how do we streamline and make certain eligibility waivers and the administrative process becomes easier? And that is something that consumers and everyone within it would say amen to, I'm sure. Increase access and outreach and public education. We're still hearing that there's so much going on that's great in the state, but the awareness, the outreach, the education needs to continue to be a priority. We also talked about technology and the use of technology for both the way in which it creates more effective coordination, human connection, engagement, all the things that we can do to integrate our technologies with innovation and the use of AI as we move forward. Continuing to strengthen housing and community living options was really important. Informal caregiver health and preventing burnout. So important to think about our informal caregivers, as well as finally that how do we get forward in a time where we have to think of other options for financing. And so getting innovative and understanding what is out there that we might consider. And I think that's a really critical part to really advancing the innovative aspects of what we're doing in community. So those are some of the opportunities. So then into aspirations, you'll find some of our aspirations obviously are continuation of the opportunities and kind of putting an exclamation point on what will we be known for. We will lead the way in Connecticut by doing what, and our communities will experience what as a result of our aspirations. How do we become a national model? Ultimately, knowing that choice has always been at the forefront, and as we think about our residents in Connecticut, so keeping choice in the forefront and making certain the choice that best fits individual needs is critical. Ensuring that there is that thriving, resilient workforce that is really sustaining a culture that is around well-being and professional growth. Ensuring that the high quality housing is available, and how is that integrated with livable communities? And that's where certainly transportation comes in. But ultimately, how do we combine those two and really afford individuals to social connection when we think housing? Again, going back to technology, leveraging all we can with the tools available and ensuring that's improving the way we're coordinating our system. Building on prevention and the ways forward that we can think about healthy longevity and how we take care of ourselves preventatively is so important. The way in which we're providing the highest dignity, independence, and quality of life for our consumers. And then ultimately, it's a shout out to Margie as well, who's been beating the drum of something that I believe is something to consider, which is how do we create a strong multi-sector plan where we're really sort of moving beyond just the long-term care financing options and really thinking about how do we build a cross-sector plan for Connecticut that really looks at healthy aging, a community of well-being and independence, where I think we're community focused but system integrated, as well as grounded in Connecticut's priorities and realities, but really trying to advance things nationally. Next slide, please. So these results, we did not get to the results yet, and we intend to, as we really cement further our opportunities and our aspirations with other stakeholder feedback and involvement in this plan, we will get to this really important category, which is results, maximizing our impact, the resources and talents we'll need to bring to the table, the methods that we'll use to track, measure, and the outcomes that we must achieve. And so that is where we came during our time together. It was really a 2.5-hour brainstorm with all that information. So kudos to my colleagues and friends. So we collect the data, check the first strategic planning session. And now the next step is to now take this information, synergize it, but further streamline and come up with questions on additional ways we'll get stakeholder feedback. Obviously, Michael Warner's group, advisory council, and other groups, stakeholder groups will go to and organize to get really some cross-sector feedback and ultimately more consumer input to our plan. So that is what we've been up to. Deb McNeil is the co-chair. Do you have anything you want to add that I missed, or anyone on the planning work group?
No, you summarized a lot of information into very concise. So thank you, Heidi, and thank you, Melissa and everybody for helping coordinate all of this. It was, as Heidi said, a really productive meeting, and it was great to be in person too. We were hosted at Live Well. That Heidi hosted us there. It was great. Thank you.
Indeed. Any other questions?
Seeing none, I just very much want to thank Deb and Heidi for their leadership on this committee, and to all the members of the work group who, it's very hard, as you all know, to give up a half day to do something in person, but I really think it made all the difference to be together in person, uninterrupted. The fact that Heidi provided phenomenal food in a beautiful location didn't hurt at all. But it was a very productive group. And as you can see, we started with that color wheel of everybody's goals and priorities being so vastly stratified. And by the end, going through the SOAR exercise, you can see how Heidi was able to put it together, that the group really was able to coalesce around some general themes and priority areas. So real impressive work. And I think it's going to be further informed by the work that now Karen's, the implementation work group is doing, where now they're getting into the meat of finally being able to drill down into their focus areas. They're going to get the annual update, and where they'll be able to provide us with a snapshot of, well, how are we doing on the goals we have now, to help further inform the strategic planning for what should be our priority and our focus as we set the goals for the next plan. So really the two groups are doing so much, and I'm so grateful to, because this is all in-kind volunteer time from the members of these work groups, and I am very grateful to everyone who's participating. So with that, are there any, oh, and the other thing I wanted to draw, it just occurred to me, hearing it all together, all in a line, if you look at the new charges that our group is going to have to study in the coming year, the legislative changes that were made, they really feed beautifully into some of the areas that the implementation group has identified as focus area buckets, and the priority areas that the next planning committee has worked on. And I think that the fact that all those additional areas of study also speak to why that concept of perhaps having the goal of working the state toward a multi-sector plan on aging and disability makes sense when you look at the broad swath of and the fact that we're such a tiny state, having one large plan seems to be making more and more sense as we delve into this. So thanks everyone for your good work. So we are doing great on time. So with that, I'm going to move on to member updates and announcements. Do any planning committee members have any general updates or announcements they would like to make? Margie.
Thanks. I'll be super quick, and it's related to all the plans that we're talking about. So our Bureau of Aging will begin its process to develop its new state plan on aging. We're going to start around July 1st. We've already started thinking about it. And as I shared with the Long-Term Services and Supports Development Work Group, we're going to look for ways to align and coordinate our process with the long-term care plan. There are a lot of ways that we, especially with consumer input, we're looking forward to that. So as we think about different state plans and how things can align with the long-term care plan, we're happy to be part of that process. Thank you.
Thanks, Margie. And I think you raised a really great point. And as other people are developing any of their state plans or federal reports where you're required to get feedback, the Long-Term Care Plan Development Committee is looking to do focus groups and if you're already holding a focus group on something, if you have a plan you have to do too, since we're all trying to talk to the same people, I think the more we can come together and work together to hold focus groups or surveys or whatever it is we decide to do to get public feedback in a more coordinated manner is we're open to that as an excellent way to move forward. So thanks for highlighting that, Margie. And also, I cannot believe you are already planning for the next state plan because I feel like we just got the other one approved. So kudos to ADS. Anybody else? Okay, seeing no further member updates and announcements, I'm going to turn it over now to Michael Werner from the Long-Term Care Advisory Council. Michael, do you have any comments you'd like to share with the group?
Yes, thank you so much. And really just kudos to you, Melissa, and also Heather for an amazing meeting today. It's been so robust, so substantial, and it's really great to feel all this energy and momentum going forward as we are just coming off of a very busy legislative session. I want to thank all the legislators here on the call, Representative Garibay and Belinsky and Senator Lesser. Thank you all so much for all of your leadership. And I also want to note the recent Connecticut Oral Health Initiatives Legislator of the Year awards going to Rep. Garibay and Belinsky. That was really great to see and attend that last week. And Heidi and Karen D'Onofrio, you guys are doing such amazing work. We're so grateful for your leadership on these subcommittees and all of the talents and gifts and energy that you guys are putting into this work is really supercharging it and bringing all these wonderful perspectives together. So I'm very delighted about all of that, and just want to continue to just encourage the group as a whole as we think about all the different areas of opportunity and innovation through all of these different collaborations, and as we look across the nation, across the world, and even right here in Connecticut, what are the things that we have here? What are the opportunities to uncover? How can we better connect things that are already existing? And just delighted to see over the last session this work that's been continuing to uplift these areas of focus that we've had at the advisory council surrounding compensation for spouses, surrounding oral health, and just really being mindful of how important that is systemically to the body, particularly for our older adults. Just a fun, friendly reminder that as of last year, that 1 in 4 of our residents are 60 and above, and in the next decade and a half or so, it's going to be 50 to 57% of the population is going to be 60 and above. So that's why all of this work is so important, all the seeds that we're planting here. We're going to be having our next meeting of the Long-Term Care Advisory Council on Thursday at noon. So looking forward to seeing folks there at that call, and just really want to once again commend you, Melissa, and thank you again, Heather, too, for your presentations and for a wonderful meeting. Thank you all.
Thank you, Michael. And so hope folks can join the advisory council meeting. If you haven't been in a while, they have a very full agenda, and it's great to get to hear from the people doing the work, to hear from our providers, from our advocacy groups. And so, Michael, thanks for your leadership of that committee. So is there any public comment at this time? Representative Garibay.
I just wanted to say again, after sitting and listening to all of you today, how amazing you all are. And you know me, I don't talk a lot and I don't BS a lot. So it's really, really true. And I wish that everyone in the state of Connecticut, because you may not hear it, I don't know if you do, but as legislators, we always hear the negative. You're not doing enough. You're not doing anything. You know, this about the state, whatever. But listening to this all today, I'm humbled to be in your company, and I mean that sincerely. But I also do hear from a lot of the elderly as I travel this state, and they will say they are aware and they are saying thank you for what you are doing at the state to help make our lives better and protect us. That is true. I hear it, I don't know how many times a week. So know that in your work that people are watching. And lastly, Melissa, you got to show me how you did that clap thing. That was amazing. And I'm looking up there. I can't find it, but we'll talk about that another time. But really,
Yeah.
truly, I thank all of you. I thank my aging committee, Rep. Belinsky, Matt Lesser, Jillian Gilchrist, everyone that has helped legislatively, but all of you that give us all the information, etc. So I really appreciate you. Thank you.
Thank you, Representative. And also, this is a good time. Seeing your face reminded me, Representative Garibay had to step away for a moment, so she her vote was not recorded. So just for the record, I just want to state for public record that she voted in favor of the slate of tri-chairs that were put up for vote. So we can add that to the minutes. Any other public comment? Seeing none, I wish you all a wonderful summer. I will be seeing you all in various capacities as our work groups continue to move forward in their endeavors and all the other work that we are all doing together. So, I hope everyone does take time to enjoy the summer, that there are good vacations on the books. And with that, I will entertain a motion to adjourn.
So moved.
Thank you, Michael Centuro. Is there a second?
Second, Senator Lesser.
Thank you, Senator Lesser. All in favor?
Aye.
Aye.
Any objections? Hearing none, I wish you all a good summer. Meeting is adjourned at 10:41.